In this video, I'll be talking about the bilaminar and trilaminar discs and their derivatives. First of all, the implantation of the blastocyst and the endometrium of the mother's uterus is completed by the second week, during which extraembryonic structures form, such as the amniotic cavity, the amnion, the yolk sac, and the allantois, or the connecting stalk. Changes to the embryoblast occur during implantation. By the 8th day, the inner cell mass is differentiated into two layers which form the bilaminar disc. We've got the epiblast, or the ectoderm, which is formed of high columnar cells adjacent to the amniotic cavity, and the hypoblast, which is formed of low cuboidal cells adjacent to the yolk sac. Now let's move on to the extraembryonic mesoderm. The extraembryonic mesoderm is a loose connective tissue that arises from the yolk sac. It fills the space between the cells that form the outer layer of the blastocyst, which are the trophoblasts externally, and the exocoelomic membrane and amnion internally. So basically, it surrounds the amnion and the yolk sac. Multiple spaces appear within the extraembryonic mesoderm. These spaces then unite or fuse to form the extraembryonic coelom. Now we go on to the gastrulation. What is the gastrulation? Gastrulation is the process through which the bilaminar embryonic disc is changed into a trilaminar disc. Here we can see the intraembryonic mesoderm, or the secondary mesoderm, has formed between the ectoderm and the endoderm to form a trilaminar embryonic disc. The gastrulation is characterized by three things. 1. The appearance of the primitive streak. 2. The development of the pericardial plate. And 3. The differentiation of 3 germ layers. Let's see the primitive streak first. The primitive streak is the first sign of gastrulation. It appears on the 15th to 16th day. It is a thickened band that appears in the caudal part of the dorsal aspect of the epiblast. It gives rise to migrating mesenchymal cells by the end of the 3rd week, and this is its function. Now these migrating mesenchymal cells give rise to the intraembryonic mesoderm. After the formation of the mesoderm, the primitive streak becomes an insignificant structure in the sacrococcygeal region and degenerates by the end of the 4th week. If the degeneration of the primitive streak wasn't complete, remnants of the streak will form a benign tumor of incomplete differentiated 3 germ layers called the sacrococcygeal teratoma. This tumor is common in female infants. Now we move on to the precordial plate. The precordial plate is a localized area of thickening of the endoderm. It indicates the future site of the mouth or the oropharyngeal membrane. It is an important organizer of the head. Now the notochord. The notochord, it acts as a temporary axial skeleton for the embryo. It will later on be replaced by the vertebral column. It extends from the primitive node. The primitive node is the anterior end of the primitive streak, all the way to the oropharyngeal membrane. Vertebral column later on forms around it. It induces the overlying ectoderm to thicken and form the neural plate and tube, which will later on give us the CNS. It then degenerates and disappears as the vertebra form, but it persists between the vertebra as the nucleus pulposus. So the function of the notochord is to define the axis of the embryo and gives it rigidity, and it's the basis for the development of the axial skeleton. We've got something called the notochord process. And the notochord process is an extension of cells from the primitive node to the oral cavity. Now to the differentiation of the 3 germ layers. We've got an ectoderm, intraembryonic mesoderm, and endoderm. The intraembryonic mesoderm is divided into a paraxial or a medial mesoderm, intermediate or nephrogenic mesoderm, and a lateral mesoderm. This is the paraxial mesoderm, intermediate mesoderm, and a lateral mesoderm. Here we can see the notochord. By the end of the 3rd week, the paraxial mesoderm begins to divide into cuboidal masses that are called the somites. The first pair of somites appear by the end of the 3rd week in the future occipital region. Hence, it develops craniocaudally, meaning from head to toe. Now, prominent somites during the 4th and 5th weeks are considered of the criteria for determining an embryo's age. Now to the endoembryonic coelom. The endoembryonic coelom is similar to the extraembryonic coelom, but the spaces here develop in the lateral mesoderm only. So, the endoembryonic coelom is formed of isolated spaces that appear in the lateral mesoderm. These spaces soon unite to form a single horseshoe-shaped cavity, just like the one we see here. During the second month, the endoembryonic coelom divides into pericardial cavity, pleural cavity, and peritoneal cavity. Now to the derivatives of the 3 germ layers. Each of the 3 germ layers will give rise to specific tissues and organs. Now let's take some examples of these tissues. The embryonic ectoderm gives rise to the surface ectoderm, which is the skin, and the neuroectoderm, which will give rise to the central and the peripheral nervous system. The mesoderm. The paraxial mesoderm will give rise to the skeleton, strained muscle, and dermis of the skin. The intermediate mesoderm will give rise to the urogenital system. The lateral mesoderm will give rise to the connective tissue and the smooth muscle of the viscera. The embryonic endoderm will give rise to the epithelial lining of the respiratory passages and the gastrointestinal tract, including glands such as the liver and the pancreas. Thank you for listening, and best of luck.